Hello, my name is Brycen Walker. I'm a soccer player at Richmond High School. Um, I've been feeling a little under the weather lately, and the past couple of days, and just last night, I kind of threw up, and I've been losing energy during practice and during the day, and practice has just been getting a little tough for me. I get dizzy and having shortness of breath more frequently than before. Um, and I've also been having this pain in my chest. And I just coming to see you today just to see if there's anything wrong with me, especially last night after I threw up. I knew I needed to go see somebody. So just coming to see you today if anything was wrong.
Hi, so when observing Bricen, I took his temperature. He had a fever of 101.2 and he was very warm to the touch. I then listened to his heart with my stethoscope and he had very obvious heart palpitations. I then followed up by listening to his lungs, and you could tell he was very short of breath and just had general trouble breathing. He was struggling a lot. I looked at his extremities and noted swelling in his lower extremities, and I palpated and realized that it was pitting edema. And so now it's on to Katie.
Based on history, palpation, and observation, I decided to refer Bricen out for further testing to obtain an accurate diagnosis. The tests that were completed on Bricen were an ECG, a chest x-ray, an MRI, and an echocardiogram. We decided to use a variety of tests to detect the severity of any abnormalities he is experiencing within his heart, such as possible arrhythmias, inflammation, or fluid possibly causing these issues.
Based off their history, observation, palpation, and special tests, I suspect that the patient has myocarditis, which can lead to congestive heart failure. So treatment and follow-up for this patient, so it would include medications such as diuretics and antiarrhythmic drugs. Other drugs that can be used are vasodilators and angiotensin-converting enzyme inhibitors. So this patient should refrain from sports for 6 months, and then we will reevaluate their heart. So within that, we will evaluate it for during rest and exercise, and if then their heart seems normal with no abnormal palpitations or anything like that, they will be able to return to play.
So everyone was right. My condition was myocarditis. Myocarditis is associated with about 5 to 22% of sudden cardiac deaths in young children. This can happen if this condition goes left untreated, which is why it's very important for us to be really cautious in the treatment of this condition.